What's pregnancy? I know that sounds like a sort of a silly question. Well, pregnancy is when you're pregnant with a baby in your belly. But what actually is it, other than something that's fairly infrequent, that's normal, natural, and physiological? But what is pregnancy? Well, the reality is pregnancy is moving you into becoming a parent, whether it's your first birth or subsequent births. And let me ask you a question. When you think of being pregnant, do you think about what skills you might apply to that period of time? Well, it depends on your religion or your culture or what your neighbors think or what your care provider is telling you. But pregnancy is the time before birth. And it actually is divided into 5 phases. Conception to 12 weeks, 12 weeks to 24, 24 to 36, 36 to the birth, and the birth. You're still pregnant until your baby comes out of your body. What are you being encouraged to do to prepare for the birth? Pregnancy lasts upwards to 9 months, give or take. How long does birth last? As a pregnant woman, you know that as soon as you fall pregnant, from conception until your baby is born, you are pregnant 24/7 at every nanosecond of the time. You have another human being growing inside you, and that human being has to get out of your body one way or another. Up until recently, the only way out of a woman's body was for a woman to labor and give birth vaginally. And that's been true in our humanity throughout time and place. Now, there are non-laboring surgical births, cesareans, or there are unexpected surgical births after a woman has labored. So how is pregnancy connected to birth other than it's the time before? And then ask yourself, within your culture or your neighborhood, what are you being told to do to prepare for the coming birth? And this is the big question. What is the childbirth conversation that you're hearing? What is the childbirth trend that you're working under? Because societies all have messages around big events such as pregnancy and birth. In the early 1970s, when I started to work in this area of pregnancy and birth, I did so as a body worker. As a body worker, I worked with people with body issues, from disability to athletic performance to older women who had problems from having given birth, to pregnant women and to families. That was in the early 1970s in the United States. And that was quite a unique time, from the late 50s to the mid-70s. There was a childbirth trend or a childbirth concept that said, in the last X number of weeks of pregnancy, your job and your husband's or partner's job is to learn a set of skills so that if you're low risk, you can achieve a natural birth, pain-free labor without medical care. We didn't have any choices, but we had skills. We were taught skills, breathing and relaxation skills. And so we, as women and our husbands, we worked together during the activity of birthing our baby. So maybe you're getting the gist of what I'm about to say. Pregnancy, as the time before birth, is the time to prepare for the birth. When I gave birth last in 1982, skills were gone out of the United States childbirth classes. Classes were now about information, because the childbirth trend or the childbirth concept was that women know what kind of birth they want, and for low-risk women, you should make a birth plan, tell your birth providers what you want, and then expect them to give you the birth you want. And at all costs, you should avoid the interventions which are unnecessary and imposed on you and that prevent you from having a natural birth, pain-free labor without medical care. And so everybody wrote a birth plan. And that's the concept we're in now. Skills were left behind. And back in the early 70s, the families that I worked with who were not low risk wanted to be included in how to have an empowered birth. And the families that I worked with that may have been low risk, many of them chose medical care. There weren't any legal midwives at that point. And what we learned very early on was that 100% of pregnant women are going to give birth one way or another, and that pregnancy is the time before that big one-off event, that infrequent activity, the activity that cannot be replayed, and the activity that leaves birth memories for the rest of your life. So it turned out, from our perspective as birthing better families, we wanted skills to work through the activity. And when choices came along 10 or 12 years later, we knew very profoundly in the depths of our soul that the majority of women do not have choices, and that choices can change. Yet, when we are skilled, we have a competency level that we can self-empower ourselves by working through the activity of birthing our baby. And when our partner has skills to help us, together we can at least greatly reduce the global childbirth goal number 2, which is suffering. And it turns out that by becoming skilled, we can also reduce the global goal number 3, which is to increase good recovery of the mother and the baby, short and medium and long term. Remember, I said I worked with women whose bodies had been damaged by birth. And in the 1970s, I was working with women whose bodies had been damaged by natural, normal, physiological births. So what is pregnancy? From our viewpoint, it's the time that you prepare for the birth. And when should you do that? Well, let me ask you a question if you've been pregnant. How many months did it take you before you could feel your baby move? Quite a bit, between 18 and 22 weeks. When was it in your pregnancy that you realized, oops, I'm more than halfway through? That's about 24 weeks, when your uterus is about the level of your navel. And what happens to your mind as you get closer to birth? It becomes more distracted because your body and your mind are beginning to focus on the birth that's coming. So Birthing Better Families discovered this sweet spot that we begin to prepare our body for the birth of our baby from 24 weeks onward. Our mind is clear. We're at an exciting period of time in our pregnancy. We may or may not yet be making choices about our birth, but we recognized that the birth is the activity, the one-off, infrequent, can't be replayed, dramatic, dynamic, life-transforming activity, and the memories last forever. And so as Birthing Better Families, we decided to develop lots and lots and lots of birth preparation skills, as well as birthing and birth coaching skills. The body skills in Birthing Better actually weren't developed for the first 10 years because 95% of us were laboring. Whether we had a short labor or we labored for days, whether we coped or suffered miserably, whether we felt okay about it or hated every second, whether we had a good outcome or a tragedy. Only 5% of us had a cesarean in 1970 because it was major abdominal surgery and modern maternity care was just not sophisticated enough to do much else. Forceps were around, episiotomies were around. That was the medical effort to try to help a big object get out of a woman's body. But in the 1980s, the cesarean rate tripled. And the tripling of the cesarean rate was not because doctors were running around with knives wanting to cut us open, as some people have said. The tripling of the cesarean rate occurred in modern countries. And why did that happen? Well, it was very simple. We got birth control. That meant we cut down the size of our families. We had safe and legal termination. We cut down on unwanted pregnancies and sometimes pregnancies that revealed themselves to have an unviable baby or risked our lives. And women in society went back to work. And one other thing socially, which has to do with fashion, we started to wear bikinis. And why was this important? Because we're always having a conversation around pregnancy and childbirth. So back then, in the late 70s and the early 80s, there was a lot of chatter about childbirth. In the United States, people wanted midwives. Around the rest of the world in developed countries, midwives had always existed, but some wanted a more independent midwifery profession. It's right, women did want choices. That makes sense. So one of the choices they wanted was to be awake if they had to have a cesarean. They wanted their husbands with them because we, women who were laboring, did have our husbands or partners with us. And we wanted to be awake if we had to have surgical birth. And more important than anything, we didn't want to be left with that ugly scar in our belly. And we wanted to make certain that our fewer children survived birth. And so we put pressure on the modern maternity system to come up with something other than the classical cesarean and something other than general anesthetic. And they responded with a bikini cut or the low-lying incision and spinals and then epidurals. And our husbands could be with us and we could be awake, and the cesarean rate tripled. And what does this have to do with pregnancy? And what does this have to do with skills? Birth is the activity that each of us does with our baby. And the word activity does not mean it's over in a blink of an eye. It means it takes time. And time is composed of a breath in and a breath out. And time is composed of where our body is in space, our full body, upper body, or lower body. And time is filled with what we think and what we feel. And what we know is that this activity doesn't end until our baby is out of our body. And the first global childbirth concept that has always existed will always exist. You never know what your birth is going to be like. However, what all of us do know, all of us who have given birth, is that it was an activity we did, with or without skills. And now is the time to grow a childbirth concept that brings skills, and those fortunate enough who have choices, and those who have choices change, or those who lack choices, can still self-learn and apply skills to the activity of birthing their baby, one breath at a time, one position or posture at a time, one thought or emotion at a time. And our partner can help us. Lamaze and Bradley taught us that, showed us that clearly, because multiple millions of us, low risk or high risk, we reduce that global goal number 2, suffering. And obstetrical nurses and obstetricians in the United States in the 60s, 70s saw multiple millions of families empowering themselves by using skills. So 24 weeks begin to prepare your body for birth. You might not be using Birthing Better resources, and that's up to you. Find other skills-based methods that focus on the body, or other ways that you're focusing on the body. But I want to tell you a caveat in this. When I was pregnant with my first baby, and up to today, women are told to do pelvic floor exercises in pregnancy. And that's wrong. It's not maybe, it's wrong. How do we know that? Tighten up inside. Now, ask yourself if something the size of a grapefruit was going to tug us open so that the grapefruit could move out of us, do we want to be tight? No, we want to be open and soft and pliable. Do Kegel or pelvic floor exercises up until 24 weeks and after the birth, but they are not birth preparation exercises. They are counterproductive to opening up and letting a big object out. If you have access to other methods to create space in your body or to balance your pelvis, such as the chiropractors in the International Chiropractic Pediatric Association, or ICPA, use them. Use resources to open up your pelvis and prepare your birth canal. Here's another caveat. Perineal massage only works on the last tissue your baby has to come out of. And if that last tissue tears in a first-degree tear or a second-degree tear, it will self-heal. It is from the open cervix into the top of the birth canal, down through the lower part of your sacrum, and around your rectum. That's the tissue you need to prepare. That's internal work. That you start at 32 weeks. And that's a Birthing Better skill that you may not find anywhere else. So, at 24 weeks, start to prepare your body. You want to create space in your pelvis and mobility and flexibility. Birthing Better shows you how to do the hip lift. Do it on your partner first so that they feel it. Why can they translate from their body to your body? It's simple. We all blink, we all cough, and we can all tighten up our rectum. We are essentially the same human being with small variations. So the more that a man or some other person can feel in their own body what they need to do in our body, it's easier for them to do it. So the hip lift creates space between your two hips. Sit bone spread creates space in the lower part of the area around your rectum. The pelvic clock is a breathing exercise in which every time you breathe in, you expand inside your pelvis, and every time you breathe out, you go around inside your pelvis, softening in your sacrum, and in one hip, and in your lower belly, and in the other hip. There are exercises to create mobility in your sacrum because that's the bone your baby needs to push back and out. act in order to turn underneath your pubic bone to head to your vaginal opening. Doing that is what causes you to feel pressure on your rectum and sometimes have a bowel movement. So preparing your body at 24 weeks begins to make common sense. And then you begin to learn skills like breathing, good touch so that you're comfortable with being touched in birth, communication that you can tell your partner in simple ways when to touch and when not to touch, and what to do with your brain that's constantly thinking, and how you can perfectly well accept lots of negative thoughts and still manage and cope well by applying skills. We have been taught since the 1980s that women should get out of their cortical brain into their primal brain, and that's nonsense. When we are highly skilled and we empower ourselves through managing through a challenging activity, that is what we need to be doing. Our primal brain is active whether we activate our cortical skills or not. That's birth happening to us. And that's what happened to us throughout the world and time until 3 obstetricians said, hey, become skilled. And then a global movement said, cows and cats aren't taught. You don't need to be taught. Just get left alone again to discover birth on your own. And that you know what positions to get into, but in reality you don't. Because I can't tell you how many women who are having progressive contractions, when their contractions are getting longer, stronger, and closer together, and who lack skills, then get into a hands and knees position that slows the birth down. They feel better, but they are slowing the birth down because the baby is no longer aligned into the pelvis. So Birthing Better actually even has skills about progressive labors and how your partner can see and hear you and can determine whether each contraction is having a good peak or whether it's plateauing off and stalling, and then can help you adjust your body to help your baby open you up and come down through and out. So pregnancy plays a vital role other than just growing your baby. The role is for you to become skilled to do this one-off and frequent, can't-be-replayed activity of which the memories last your lifetime. So just think back now on a birth that you had skills to work through and a skilled birth coach, hopefully, to help you. And if you didn't have a skilled birth coach, just rely on yourself, as many of us have. And look back on a birth in which you just felt out of control or it happened to you. Which memory do you want? Do you want to self-empower yourself? We hope so. And we want you to spread the word throughout your friends and families and on social media. We need to grow a skilled birthing population for all births. If you're planning a non-laboring cesarean, whether you want it or don't want it, enjoy preparing for the activity you're going to do and learn the skills so that when you go to the hospital, you're using skills. While being prepped, you're using skills. And during surgery, you're using skills to work with activity you and your baby are doing. You stay engaged, and that helps after the birth when you become a parent. You feel more self-empowered, and this is important for both women and men. So let's look at pregnancy as the time before birth and the time before parenting, and let's begin to realize that that time before has very unique skills associated to it. In fact, Birthing Better fathers, after they developed all of the birth and bodywork skills and all of the soft skills, they realized in the 1990s that they could do all of that from 24 weeks, but they were already 6 months into pregnancy, and the majority of men felt left behind. A man is a human being. All of us, men and women, are skilled adults, and then we fall pregnant, and we fall into the black hole of not knowing what to do. So fathers developed the Pregnancy Academy courses in Birthing Better, and they developed the skills for each of the 5 phases of pregnancy because we need to morph our skills as pregnancy unfolds and as birth approaches and as birth occurs. This is called the continuity of skilled self. And so we hope you have a new understanding of pregnancy and a new appreciation of our own individual capacity to become skilled mothers and fathers mothers. And the biggest benefit is when we are skilled throughout pregnancy and prepare for the birth of our baby and use skills to birth our baby, we are much more confident parents and we work together better.